Hi, I'm Dr. Bhargav Raut from Pathofast Lab Pune, and if you've recently received your liver function test report or your SGPT blood test report and you're looking at the report and you're confused, is this SGPT level high? Is it dangerous? And what should you be doing about it? In this video, I'm going to give you a detailed chart of different SGPT levels, what they mean and what their causes are. So you will no longer be in any doubt about what to do with your SGPT level in your report. So let's begin. So the first thing that you should know is that how are the SGPT levels generally classified. So there are 4 levels of SGPT which doctors will use. The first one is what we call borderline, which is between 2 to 3 times above normal. Now the normal range of SGPT is around 30. So 2 to 3 times above 2 times above normal will be something up to 70, for by and large 60 or 70. The next is what we call a mild elevation, which is something between around 2 to 5 times above the normal level. So this is going to be something that goes from say 60 to around 150 or 70 to 150. We then have what we call a moderate elevation, which is between 5 to 15 times above normal. So if your level is something between 150 to 450, that's where you are. Then we have what we call severe elevations. Anything more than 450 is called severe, and if you cross something like 10,000, that is called massive. So these are the basic different categories in which your SGPT will fall depending upon the different causes, which I'll get into in the future. Now let us say that your SGPT is above normal but it is less than 150. So this applies to everybody whose SGPT is say 50 or 60 or 70, 80, 100, 120, anything less than 150. This is the category that you're in, which basically covers the borderline and the mild categories. Now what are the main causes for this? So as you can see in the slide, the most common cause for this level of elevation is usually fatty liver, and now this fatty liver is due to eating too much, a lot of fatty foods, you're having a lot of sugary foods, basically you're out of shape, out of weight. Or the second, probably maybe equally common problem for fatty liver is due to alcohol, you drinking too much. This is the most common cause for your SGPT to be up to 150. The next most common cause are medications. Now these medications include medications for blood pressure, painkillers, even things like medications which you take for acidity can also cause an elevation. I've done another video on this which I'll link to in the description. Then the third most common cause are viral infections like hepatitis B and C, which are also very well known to cause a mild elevation in their later stages. And the last but less common causes are Wilson's disease, alpha-1 antitrypsin deficiencies, and hemochromatosis. These are situations in which your body is unable to handle metals properly. So Wilson's disease deals with copper, hemochromatosis deals with iron, and alpha-1 antitrypsin is a genetic deficiency of a certain enzyme. All these things add load onto your liver, they damage your liver and cause this borderline elevation that we see, which is up to 150. Now what if your SGPT is between 150 to 450? So this is everybody is whose level has shown up between 150 to 450. So this could be 200, 300, 350, anything between these two. We call this a moderate elevation, and here are the causes. The most common causes are the viral infections, especially the hepatitis viruses like hepatitis A virus, the hepatitis B and C viruses, and the last is all the causes that I already mentioned in the mild elevation or the borderline elevation. So these are the 3 most common causes for your SGPT level to be around 5 to 15 times elevated above normal. The hepatitis B and C viruses are the real culprits here, because they will initially cause the level to go up a lot, and as they continue to live inside your liver and they don't get treated, they will cause this mild simmering swelling in your liver, which gives you this level between 150 to 450. The hepatitis A virus is usually gets cleared by itself, so that's not much to worry about, but it can also cause this kind of a level either in the very early stages or in the late stages, and of course all the causes that we already mentioned. Now what if your SGPT level is more than 450? So this includes anybody whose level is above 450 all the way above and up to 10,000. The most common causes are, the first and most common cause is some kind of a chemical injury, either due to a medical overdose or because of an ingestion. You've had some kind of chemical which you shouldn't have had. This is what happens usually in acetaminophen toxicities, where people have too much painkiller, which is the acetaminophen. This can cause liver damage. Secondly, we also have situations where the blood supply to your liver is blocked. This is a medical emergency. It will cause a massive elevation of your SGPT, and it is the second cause that I've listed. Together with this, we have all the causes that we've already mentioned. If they keep progressing, they can cause your liver to get damaged and go on raising your SGPT level. In this, especially hepatitis A in its early stages, or in its, in the stage when the virus is really strong, can cause this. Even hepatitis B and C can cause a high level, but only in the acute phase in the first 6 months, not later on. So I hope I've been able to give you a clear idea of what are the causes of this level of SGPT.